Good morning. I am Nithya, Professor from Sri Venkateshwara College of Physiotherapy, Tamil Nadu, India. I would like to thank Inti International University for giving me this wonderful opportunity to present in this forum. Today I am going to present a topic on the effects of sensorimotor training and proprioceptive training to improve balance in chemotherapy-induced peripheral neuropathy. So peripheral neuropathy, which is chemotherapy induced, is a common and challenging side effect of several commonly used anti-canceral drugs. So it is well known that the treatments which is based on platinum and taxanes are linked to increase the incidence of CIPN. So there is a prevalence of 19% to over 85%. Chemotherapy-induced peripheral neuropathy is one of the most common adverse effects of anti-neoplastic drugs. Clinically speaking, CIPN is primarily a sensory neuropathy, but because of that, there will be motor and autonomic abnormalities of various severity and duration. So because of the sensory neuropathy, the patients may have other impairments like balance, motor weakness, gait impairments, etc. So there is, because of its high incidence among cancer patients, chemotherapy-induced peripheral neuropathy poses a significant challenge to cancer patients, survivors, and their healthcare professionals. So this is particularly true given that there is currently no one effective way to avoid CIPN. Sensory motor training involves an increased input of proprioceptive and somatosensory stimuli. Silvo et al. States that correcting a muscle imbalance and guaranteeing an appropriate motor program at the level of central nervous system will increase the input of proprioception as well as somatosensory stimuli. So sensory motor training improve static as well as dynamic balance, also proprioception in people with peripheral neuropathy. Proprioception is the perception and understanding of the position and movement of the body, which includes balance, motion, and environmental navigation. Here comes the proprioceptive training, which is a form of exercise that focuses on improving proprioception, which is the body's ability to sense and interpret stimuli regarding the position, movement, and balance. Since there is balance impairment and gait impairment and other motor impairments because of sensory problems in chemotherapy-induced sensory neuropathy, these two are the challenging and very effective exercises or treatment regime that will help to improve the balance in chemotherapy-induced peripheral neuropathy. My aims and objectives are: this study will find and compare the effects of sensory motor training and proprioceptive training on balance in chemotherapy-induced peripheral neuropathy. Null hypothesis states that there is no significant improvement in balance followed by sensory training or sensory motor training when compared to proprioceptive training. There is a significant improvement in balance followed by sensory motor training when compared to proprioceptive training. This is my null alternate hypothesis. The study is a randomized trial with true experimental study design with active control parallel group. So here the control group also undergoes proprioceptive training. That is why it is active control parallel group. The study population is chemotherapy-induced peripheral neuropathy. The study setting is Erode Cancer Center. So I have selected the samples through convenient sampling technique. So coming to the sample size, I have taken 30 chemotherapy-induced peripheral neuropathy patients, which is located into Group A and Group B. Group A, which is the experimental group, consists of 15 chemotherapy-induced peripheral neuropathy patients, and Group B, which is the control group, which is comprised of 15 chemotherapy-induced peripheral neuropathy patients. So the study duration is 6 months and the treatment duration will be 12 weeks. Both the groups undergo the same treatment duration as well as the study duration. Coming to the criteria for selection, my inclusion criteria are: I have taken the age group between 30 and 40 years of age, and people who are diagnosed as cancer, that is the post-cancerous diagnosis is 3 to 6 months. Here, the cancer patients are, their cancer should be cured, but the effects of chemotherapy will be there. So those who have completed chemotherapy treatment and are medically stable. And this chemotherapy-induced peripheral neuropathy will be subjectively assessed by FACT-GOG NTX, which is an assessment tool. There is functional assessment for chemotherapy and gynecological oncology group neurotoxins. So from this, I have taken the, selected the patients. Here, according to WHO, the CIPN grade is 2 to 4. So it is according to the severity of the chemotherapy-induced peripheral neuropathy. 2 is milder and 4 is more severe form. Here, the balance impairment is assessed with work balance scale, and I have taken moderately impaired patients. Coming to the exclusion criteria, chronic medical conditions such as poorly controlled diabetes has taken, because these uncontrolled diabetes will not help in the study. So significant neurological diseases like stroke, ataxia, cerebellar diseases and other neurological diseases are excluded from the study. Here, other peripheral neuropathy patients who are already diagnosed are excluded. Severe cardiopulmonary diseases that may affect the performance are excluded from the study. Unstable bone metastasis, cognitive deficits are also excluded. Vision and auditory problems, also the people who are unable to understand the commands and the training program are also excluded from the study. Coming to the methodology, my independent variables are sensorimotor training and proprioceptive training. Group A, which is the experimental group, undergoes sensorimotor training, and Group B, which is the control group, who underwent proprioceptive training. Dependent variable is balance. So outcome measure is work balance scale. Coming to the statistical tool, paired or dependent t-test, which analyze the within group analysis, and unpaired or independent t-test, which analyze the group A and group B. Coming to the methodology, the patients were recruited according to the selection criteria. Informed consent were obtained from the patients. They were allotted to both groups equally. Coming to the sensorimotor training, these are the exercises which I have given, but the sensorimotor training are gradually progressed to different grades using unstable surfaces. Example, Swiss ball, Bosu ball, or any mat, so which is unstable. The exercises are given for 3 days per week for 45 minutes. Proprioceptive training are also given for 3 days per week for 45 minutes. So here I have given the following exercises. So both the groups have a rest period which is convenient to the patient. These are the demographic analysis, the age and the 6 categories and the types of cancer I have taken. So this is the data analysis, where within group analysis of group A and group B says that the pre-test mean of group A is 37.13, post-test mean is 48.2, and the t-value is 60.90. Group B, the pre-test mean is 37.4, post-test mean is 44.66, and the t-value is 16.43, and the level of significance is 0.05 for both within group analysis as well as between group analysis. Coming to the between group analysis, the t-value is 14.22 and the level of significance, as I have mentioned, is 0.05. Coming to the results, the statistical analysis shows that there is a significant improvement of balance in both the groups. But comparing the post-test of Group B, Group A, that is the experimental group, shows a significant improvement in the balance. And the p-value is 14.22. Hence, the alternate hypothesis is accepted and the null hypothesis is rejected. The present study, coming to the discussion, the present study evaluates the effects of sensorimotor training and proprioceptive training to improve balance in chemotherapy-induced peripheral neuropathy patients. So the results of this present study shows that there is a significant improvement in balance in the experimental group who underwent sensorimotor training when compared to the proprioceptive training. According to Trekman et al., the sensory motor training enhances quality of life, balance control, nerve conduction velocity and amplitude, and also pain, which is associated with chemotherapy-induced peripheral neuropathy. Exercise helps these patients with their sensory and related motor problems. According to Jenna Muller et al., this sensory motor training might be effective strategy to prevent sensory symptoms in the feet during the neurotoxic chemotherapy itself. So this enhances the chemotherapy tolerance as well. Coming to the proprioceptive training, Abir et al. Says that this proprioceptive training can be used as a simple as well as this is a cost-effective treatment program in improving functional balance in diabetic neuropathy patients. So the above researches supports my study and hence sensorimotor training and proprioceptive training can be used to treat the chemotherapy-induced peripheral neuropathy patients, among which the sensory motor training is more effective than proprioceptive training. Coming to the conclusion, to conclude that sensory motor training proves to be more effective than proprioceptive training in improving balance in chemotherapy-induced peripheral neuropathy patients. So the following are the limitations and recommendations. So cancer patients can be categorized into different groups, which means a particular group of cancer patients can be taken into the future studies. So in my study, I have taken all the cancer patients who are having chemotherapy-induced peripheral neuropathy. But in future studies, we can include any one type of cancer. So other outcomes like vibration sense and gait can also be taken. In future studies, other treatment strategies to improve gait or balance or some other treatment strategies can be used. So here I have not followed up for a long time. So this long time follow-up has to be followed in the future studies. That is my recommendation. So multiple outcome measures can be used. Since in this study we have used only one outcome and one outcome measure. So in future studies we can also include gait parameters as well. Combined treatment protocols will be maybe more helpful and a large sample size can be used. So these are my references. I once again thank Inti International University. Thank you so much.